Welcome to this Startup Talks at the heart of things, Anna Erkstam's journey to entrepreneurship. And as you can hear in the title, today we will talk to Anna Erkstam, CEO of the innovative medtech company BioReperia. The company has developed a technology that can determine the effects of various treatments of cancer patients using a zebrafish platform. It sounds almost unreal, and she will explain a bit more about that in a bit. Anna holds a PhD in Neurobiology and Neuroscience, and she went straight from the research world to being a key figure in running an innovative startup. She learned everything from sales to accounting and broadened her knowledge in entrepreneurship enormously. I would like to hear about that transformation, and I want to know how her entrepreneurial journey looked like. And what motivates her? What is it like to throw yourself into the unknown? What's it like to be at the heart of things in a startup? I have plenty of questions to ask, and I bet the audience does too. My name is Lina Helgesson. I am community manager at LEAD. And I will start off by telling you a little bit about LEAD and who we are and what we do. And then I will welcome Anna to the virtual stage to have a little chat about her journey and experience in BioReperia. And finally, I will invite the audience to ask questions. So please feel free to ask any questions that you might have in the Q&A function down below as we go along, and I will try to raise them during the talk or afterwards. I really want to push for this because really take the opportunity and ask any questions that you might have, and Anna will try to answer them. But first, a bit about LEAD for those of you who don't know us already. LEAD is a business incubator, and then I should probably start off by explaining a bit what exactly a business incubator is, because that might not be that obvious for everyone. As a business incubator, we help companies grow faster and safer. So we're basically accelerating the development of startups with high growth potential to become scalable growth companies. So how exactly do we do that? Well, we provide idea owners and entrepreneurs a wide range of directed resources and services, such as business coaching, network and business contacts, support to attract financing, and much, much more. We have 2 offices in Östergötland, 1 office in Linköping and 1 in Norrköping. And we're currently working with around 45 companies distributed over the 2 locations. And about 50% of these companies come from the industry and about 50% from academia. We've been doing this for over 20 years now, and we have evaluated around 1,000 companies or projects, and we've coached over 180 startups in total. And we organize these startup talks once per month, where we invite inspiring and exciting entrepreneurs to share their stories and experiences. And hopefully it will inspire some of you to take that step towards the startup world. So now to the reason why we have all joined us here today. So without further ado, I would like to give a warm welcome to Anna Erkstam from BioReperia. So nice to have you here. How are you, Anna?
Thank you. I would start with thank you so much for inviting me. I was very honored to get the request from you. And I'm fine, thank you.
That's great. So now I want to, before we dig more into who you are and your journey, I would just like to know a little bit more about BioReperia and what exactly does the company do?
Yeah, so I think you pitched our company really, really nice. But the core of what we are doing is that we have developed this platform based on zebrafish, where we can actually evaluate all different treatments for every single cancer patient to know which treatment would be the most efficient for that specific patient. So really personalize the treatment for every individual cancer patient. So today it takes approximately 6 to 12 months before a cancer patient is given the right treatment that is mostly beneficial for that person. But we can do this in 5 days. So this is really something that we all are so happy to work with, and it's a really innovating and fun platform to work on. And the platform can also be used for evaluating new drugs. So it's not only current drugs on the market, but we also help pharma companies developing new drugs making them reach the market much faster and much more efficient than today's pipeline.
That is so interesting and a very, very important product. I mean, it's about saving lives basically. So that's amazing. And at what stage is the product right now? Because you have launched one part of the platform, right? Or can you explain a bit more?
Exactly, yeah. So the part of the platform that we approach pharma companies has been in the market since the company started. It was actually because of that the company started. We had customers wanting to use our model. So then we made a package of it and starting selling immediately. So that's on the market. And of course, it's a lot of development there as well. And I think we will maybe talk a bit more about it later. But the platform where we approach hospitals to our models to be used for patient care, it's currently in the process of quality assurance and CE mark, since this is really important for products that is used by the healthcare. So hopefully we will have our first product to be used in the clinics, hopefully next year.
Wow, that sounds amazing. And like you said, we're going to talk a bit more about that, especially that what you said about you started selling a product very fast. That's very interesting. But now let's get to know you a bit better. How did it all start for you? How did you end up in Buraperia in the first place?
Yeah, so it's the classic banana peel. I was doing research at the university. I was just about to finish my PhD, and Anna Fahlgren, who is one of the two founders of BioReperia, approached me. We know each other since before, asking me if I would be interested in going from academia to industry, trying out a new company and everything like that, starting talking about startups. And I've never heard the word startup before, but I know Anna, and I know that she's usually having a lot of interesting ideas. So I thought, why not? I don't know what to do next, and why not test this out? So I joined the company just after finishing my PhD, or actually a bit before that, joining them on a few events, meeting lead and Thomas, our business coach. But starting officially in 2017 as the first employee, joining Anna and Lasse Jensen, who are the two founders.
And what were your expectations back then? Like you said, you didn't even hear the term startup before. Well, what did you expect when you start?
Yeah, well, usually I'm not that. I don't have that much expectations of things beforehand, and I would like to build up a fresh mind of things. Of course, when they started talking about business plan and business development, and this was like kind of new words to me and a bit frightening. So I started up in the company where I felt most comfortable, which was in the lab, doing the experiments and product development. But very fast, of course, trying out all the different things in the company. I was the only employee, so everything needed to be done. So I was before lunch, I was down injecting cancer cells, and in the afternoon I was calling customers, and in the evenings I was setting up Zoom and all those kind of software things that you also need in the company.
Wow, that sounds like a journey, and it's really cool of you that you dare to do that and just try this, even though you didn't know anything about a startup. So, but I'm also thinking, like, was it challenging to go from a researcher's way of thinking to more of a business mind?
Absolutely. I think there are a lot of things that, industry, the business mind, and the researcher have in common, with like the curiosity and needing to dare to do things. But of course, it was a big change for me, especially, I must say, in the product development phase, which was the first that I experienced. In academia, you have the opportunity to really dig into things, sorting out all the different small details, and really put all the path of a certain question. Here, you need to have the business mind, thinking, will this really benefit the product? Will it be useful for the customers? And if not, then it's not worth looking more into. Then you can hand it over to the researchers in academia. Here we have a lot of new fun questions that you could dig into, but it's not up to us to do it in the company.
Yeah. And how did you learn that way of thinking? That's so different from what you're used to.
Yeah, well, it's of course we had a lot of for me, starting so fresh in the in the industry. I think all the different sessions we had with our business coach Thomas, really learning the NABC model, where you really need to dig into what is the need and how do we approach it and what would be the benefit of doing it in this way. So it was, it came in small steps, and I could grow as the company grew. So when the company learned, I also learned.
Mm. And I want to talk a bit more about this sales part, because that can be really, really scary in the beginning, to make those cold calls and talk to potential customers. And how was that for you when you started making those cold calls and talking to potential customers?
It was really frightening. I would lie if I said it wouldn't or it weren't, but I think I learned so much from it. And I had also, again, we did it together, the company. All three of us were discussing and what would be a good approach. We had really good mentors helping us with the sales process. But for me, it was really a big challenge to do this. Going from research to sales was a big gap or big leap, it took me a while to get comfortable doing it, but as I said, I got a lot of support and good advice from a lot of people, and I could take that, learn from it, test my theory, so to say, and their theories. And once I got a hang of the basics of how to approach customer and cold calls and really streamline it according to a more classic sales approach, I could use my own words as a researcher, but still be an efficient salesperson. And I think that was really a turning point for me in the sales, that I could start talking to people not as a salesperson, but as a researcher, but still being able to sell things.
And how did you come to that conclusion? Because that's a very great conclusion. It's a very successful way of doing it. How did you end up there?
Well, I think for most people, you need to put your own personal touch on things to be able to be efficient and to be able to enjoy what you're doing. But you also need to learn the hard way. You can't skip this first part with challenging yourself, because you learn so much from it, and you can't. I don't know what to compare to, but you can't like make the most advanced cake before knowing how to fry an egg. So you need to do it stepwise and listen to the people knowing these things from start to be able to do your own things efficiently later.
Yeah, and we at Lead, we always talk about, talk to the customers, do it early and learn from the customers. Yeah. And you mentioned a bit that you actually started selling a product very early. Can you please elaborate a bit more on that?
Yeah, so the company was actually started because so to give you a bit of a background, the model that we are selling and developing is an innovation that Lasse Jensen have used in his research and developed. But he got more and more requests from people outside of like research collaborations. In academia, you do a lot of collaborations with other people, but you also want these collaborations to benefit both sides. But he got a lot of requests from people that he felt was a bit outside his own scope of his research. So that's why he thought, well, let's make this as a product to be able to sell it. And then he, in this process, he met Anna Fahlgren, who is a very good entrepreneur, but also a researcher. So they came together, forming the company and starting selling, immediately. I think we had our first customer just a month after the company was actually formed. And of course, this was really early. And was the company or the product that we sold then was more in the shape of a research collaboration, but we could charge for it. But when we always took the opportunity when we were calling customers, meeting customers, being out on different conferences and events to ask people so many questions. I think they were like, okay, because if you know from the start, when you meet people, you should always have in mind what you want to know. So in this case, for the product development, to knowing how to develop the product, we tested a lot of hypotheses. So we had them written down in beforehand, knowing that, okay, if we meet this kind of person, we ask these questions. If we meet this kind of person, we ask these questions. So we were really, really prepared being out meeting people and also calling them. So in the cold call, you could also throw in a lot of different questions to the customers that were outside the real scope of the sales, but to know, so we could get the input from the customers, how they would like a product to look like. Because we can have as much theories as possible, but if we don't know what the customer wants and develop a product that the customer is not in need of, then we can't sell. So being out and talking to people, asking our potential customers questions all the time, has really been a key factor for us.
And it sounds like a good strategy, but wasn't it hard to just ask questions, or was it fun, or was it scary? How did that feel to just?
No, I think that was the easy part. Because but I think it's of course different for different people, but for me that was the easy part, because you could discuss with people. They were researchers just like me, so we could discuss it in a different level, so to say. So, and people share so much. I was so surprised. I thought that, of course, academia, but especially the industry, would really be secretive about things. Of course, some things are secrets of the companies, but to share knowledge, people are so open and often very happy to tell you. So just asking a few questions, you could get a lecture for 15 minutes about different things. So that really surprised me when we were out meeting people, that a lot of people are so happy to share.
That is a great advice to entrepreneurs and audience out there. Talk to people, ask questions. You learn so much by doing that. I was wondering a bit about, because you also went international quite fast. Was that a strategy that you had, or how did that happen?
Well, I think we decided on Friday, and Monday we went to Switzerland. No, but we, of course, it was a strategy for us. Sweden and the Nordics are very, on the edge of research, really, good in that way. But still, it's quite small market. So we knew early that we need to go international. So very early on, we took the decision to try a market outside the Nordics. And we discussed it back and forth and chose Switzerland for various reasons. But it was not just by chance we chose Switzerland, of course. And then we decided, well, we will go there, spend a week calling people, fixing meetings, and had a fully booked schedule when we went. And it was a success.
Yeah, you seem like insanely driven people in Bioreperia. Great to hear.
Yeah, but we have fun, and I think we are. Of course, everyone is really driven, but as a researcher, it's not that common that you get so close to the patients. We all, or most of us, do research on various diseases. Mapping out different pathways and the biology behind it, but being able to provide people with our platform and what we do, because we know in our heart that this will work and that it could help so many people. And like all of us, we know people suffering from cancer. It's so many people that are getting this horrible disease every day, and to be able to help them and to provide something for these people, it's so rewarding for all of us. So that's really a driving force for everybody in the company, and especially me.
And that is a typical like something that you should really focus on when you have your own company, or you're thinking of starting your own company, to focus on something that you're really passionate about, or that you feel like will actually make a difference. Because then it's easy to work like you've done and go to Switzerland and do these extra things because you're really, really passionate about it.
Yeah, I can't imagine working in a startup company with a product that I'm not passionate about. Because it's very, very rewarding, but it's also so much work. And you need really to have this. You can't just work for the paycheck because that's not big. But you need to have it in you and really be passionate about the product that you are supposed to get to the market.
Yeah. I want to take the opportunity now and just remind everyone that if you have any questions that pop up during the talk, please feel free to just write them in the Q&A function down below, so I can raise them during the talk or afterwards. All right, I want to move on a bit in your journey in Buraperia, because we discussed a bit, the product development, the cold calling, sales, and then what happened? What was the next step for you after being in charge of these cold calls and the sales part of it?
Yeah, while I was doing it, I was doing all other things as well. So I really had as I said previously, I really had the opportunity to grow with the company and try things that I would not imagine when I started. With this business development and all those kind of things, that was really scary for me at start. Once I get to come behind, the black headline of it, I really could see that, well, this was really interesting and rewarding to work and develop within. So I started moving from sales to more business operations, customer relations. So I still had kind of the sales part, but more on that side with the customer relations and building new partnerships. I also got in charge of our clinical operations with our clinical studies, talking to the doctors that meet these patients, and that is fantastic to do it, because those are the people that will use our model, but also the people struggling with these kind of questions every day. How should I treat this person? What would be, and it's actually a decision, life or death. And discussing with these people, it's so nice to do it. So moving on with our clinical operations, also with quality assurance, also, as I mentioned at the start, to be able to put a product on the market within healthcare, you need to, of course, quality assure it really, really good. So that was also something that we started off quite early. And yeah, marketing, communication, a lot of different things.
Yeah. And now you are CEO, you have a CEO, CTO, sales manager, project managers, regulatory coordinators, and you're like a full team now. What did that transformation look like from, in the beginning, everyone doing everything, to now having those different roles and tasks?
Yeah, so the actual process was not that complicated. We saw that we need to put more time into these various areas, and then we hired people to be able to put more time into them. But as the team grew, we tried to, or in the beginning, everybody is doing everything, but of course having different focus areas. But it's still important that everybody is aware of what is happening and could contribute to discussions and to development. But as I say, as the team grow, you also need to make the decision of, okay, who am I involving in certain discussions and so on. So I think that for us, as I say, we have the sales team now. We have a person dedicated to the quality assurance, and we have the project managers and lab managers taking the customer projects in the lab. But all these different operations are dependent on each other. So if you work on one part, you also need to know what would be the effect of this other part here. And for me, since I've been in the company for a long time and also been doing all different kinds of things in the company, I have quite a good impression or overview of what things really mean when you will want to implement something new. And I think that is my key role at the moment, that I have this overview and could really see how everything is put together.
Yeah, and you are really, as the title mentions, at the heart of things in BioReperia. And I'm just curious, what motivates you to all this? I mean, all these various tasks and being part of a startup. You were hired at a very early stage in BioReperia. You're not a co-founder. So where did you find the motivation to give your heart to this company and be at the heart of things in this?
Yeah, well, my motivation is that I'm really curious about things, and as long as I feel that I am developing in one way or another, I am happy. And in this company, I've got the opportunity to test everything within a company, and I'm so grateful for that opportunity, because that has I've been learning so much about myself, and also about starting a company, of course. What it means to lead a company, what a company needs. So I would also couple that to my background in research. That's also development and curiosity, but then you kind of dig, but here you broaden yourself instead. To being able to have this opportunity that I had and really grow with the company, I couldn't even dream of it.
Yeah, and speaking of this, we have a question from the audience that fits really well into what you just said. The question is, how much researcher versus company builder are you today? Could you think of going back to the research, or are you stuck in the industry?
No, I must say I'm more of a company builder, entrepreneur today than a researcher. But I don't see that these two parts are competing with each other. One is they benefit from each other. And I think it's more of a state of mind than the actual title that you put on yourself. But I would definitely say I'm more of an entrepreneur today than a researcher.
Yeah. And like we spoke about that you have tried basically everything that comes with a startup, and that's one of the major perks, I would say, of working in a startup, that you get to try so many things and develop so much personally by trying things that you never thought you would try. Would you agree on that, or what's your thought about that?
Absolutely. That is as I say, the real perk of working in a company, in a startup company. You could not get that opportunity working in a bigger company or actually somewhere else. So that's really the carrot.
So if there are any people out there who are curious about the startup world, but they're a bit scared that they don't have what it takes to be an entrepreneur, what are your advice to them?
Well, don't be scared. What's the worst thing that can happen? Try. And of course, I would say, don't be afraid to ask questions. People are very willing to share, and it's not considered weakness to not knowing. So ask, build your own opinion about it, and just go for it. As I said, what's the worst thing that can happen?
That's a great advice. What's the worst thing that could happen? I'm a bit curious about the next steps ahead now, both for the company and for you in Bioreperia. What's going on in the company now, and what is the next step?
Yeah, well, it's a great question. As maybe some know, I'm currently on maternity leave, so I've been off the company for a few months now. But we are of course working with the CE mark, trying to launch our clinical product on the market, and with all that comes with it, with quality assurance and talking to regulatory people and so on, but also to make new and bigger clinical studies to really be able to launch this product on the market. So that is really the big thing that we're currently doing.
Interesting. I hope that you manage that soon, because I'm very curious about this product. It sounds really, really amazing. I have another question from the audience here. How is it to have a product that really engages you to help patients, but at the same time you are forced to focus on how to build a company and need to earn as much money as possible to give return on investment for the investors?
Yeah, well, it's an interesting question. I would say that you can't, if you don't have a product that you can sell, and of course then would be a return of investment, you can't get it out to the patients. So it's not one or the other. They are both needed. You need to have some money to be able to launch these products, and but also to be smart when you are developing. So you need to be aware. We approach the healthcare. You can't charge how much for a product. And that is also something that you need to be open with investors, that it's not about making the most money, but we need to, if we would like this to get on the market and approach so many people that are challenged with this horrible disease, then return of investment won't be a problem.
All right. If you have any more questions, I'm talking to the audience now. If you have any more questions, please feel free to write them in the Q&A. Here comes another question. What has been the best tool experience or other things that help you to navigate?
Well, I must say, to have people around you that you trust, and trust would have the company's best interest in mind, and being able to have those people around you, and to discuss different topics with them, sharing ideas, getting thumbs up or thumbs down on certain things. I think, at least for me, it's been a key factor, because then on those people, as well as being out talking to potential customers and current customers, where you can test your ideas of how to develop, it has helped me a lot, building my experience, and knowing that that I have the right thoughts, because when you come from never been doing this before, it's like, is this right? Is this a right way of thinking? Can I do this? Is this okay to do? And when you see that, and you have people that you can test your ideas towards, and you kind of get the feedback from them that, yeah, we try this, and then you try it and it actually works. It builds your confidence tremendously. So yeah, having people around you that you can trust, and that you do it together as a team.
And if you look back at these past 4 years being part of BioReperia and jumping into an innovative startup, is there anything, maybe this is a tricky question, but is there anything that you know now that you wish you would have known back then and would have done differently or changed?
I would say no. We didn't know. I didn't know everything back then, of course. But also to make those, I wouldn't say mistakes, but making maybe a detour. Also, it helps you build your experience, because one day that will also come in handy, knowing those things, because you never know what lies ahead, and things that we then thought were not of use have been shown today to be very useful. So spontaneously, I would say no, because I think that all things build up to what you know today.
Yeah, and you for sure learned a lot during that journey. It's very obvious from this talk now. Yeah, I want to just thank you so much for sharing your journey. It's been very inspiring and very interesting, and at least I take a lot from this talk, just this try different things and learn from doing. I have a question from the audience here. If you should start your own company, what should you focus at, and what would you try to avoid? So back to what you've learned during these 4 years.
Yeah, well, what I should focus on, well, to really a bit conclude what we've been talking about, start sales as soon as you can, or not as soon as you can, prior to when you think you can. It's never too early, and develop together with the potential customer. Even if you don't have a product, be out. I would do the same thing again. Go out, talk to people, and really trying to put a path in my head of where do I want to go here, and try this out on various people, especially the potential customers. I would also focus much about building a good team. For me, it's very important that in a startup company, all people are salespeople. So it doesn't matter if you are the CEO, if you are the key account manager, or if you are the project manager at the lab, or the lab assistant. Everybody should know what the product is, and also be able to pitch the company, because you never know when you meet these people that is a potential investor or is a potential customer to you. It could be at the coffee machine at Lead, or it could be next to you on the bus on your way to Stockholm, just chit-chatting, and be able to just pitch the company with a few sentences, knowing, so everybody know what they're doing and why. I think it's so important. So start sales early, and also trying to build a good and dedicated team.
Thank you for those great advice. Okay, let's see. We have another question here. There's a long question. I'm sorry. I'm trying to read here. Okay, I'm going to read out the entire question. The product your company is selling sounds amazing. What obstacles need to be overcome to get it out in regular use when dealing with sick patients? Is there just trials and tests, or is there any resistance from people against this type of testing?
Well, the big obstacle is, of course, getting it to the market. And that will be obtained with clinical trials and eventually then a CE mark. So the clinical trials that we are doing is to prove how efficient the product is, so we can launch it to the healthcare. But I'm reading the question here again. Of course, healthcare, especially the public healthcare, there is a resistance with trying new things, but that usually lies on the more financial side of it. Is this product worth testing, worth putting money into? With our limited budget today, speaking as a clinician now, do we really want to put this much money on a test? So we really need to navigate here before we go to the public healthcare, to go to other stakeholders to be able to put it on the market, proving the efficacy before going to the public healthcare. But I think resistance within the healthcare is fought with knowledge and proof. So if we can prove that our product is as efficient as we know it is, and our preliminary or our current data show us, then it will be no problem.
Thank you for that answer. I really wish you all the best with this product. And to summarize this talk in terms of your journey and your advice, be passionate about the startup or the product that you want to sell. Build a good team, make sure that everyone in the team knows what the product does and can pitch it to anyone, and talk to people. Go out and talk and sell really, really early, or try to sell early, talk to potential customers. So thank you so much, Anna, for joining us here today. And like I said, these startup talks take place once per month. So the next one is in November. And keep an eye on our social medias and our website, lead.se, to stay updated with all our upcoming events. And you can also check out our previous startup talks on our YouTube channel, lead.se. If you missed them, there are a lot of interesting talks there too. And this one will also be published on our YouTube channel. So again, thank you so much, Anna, for joining us here today. And thank you to everyone who was listening, and have a nice evening, everyone.